our panelists. We have Mayor Michael R. Brown on. We have Dr. Stephen Weiser, President of Ultra Health System, and we have Deb Swanson, Director of Grand Forks Public Health, on to answer questions. So media members, please use the hand raise feature that is part of Zoom webinar, and we will get right into it. Our first question comes from, please media, please indicate who you'd like to answer the question and then pose your question. First question goes to Mr. Neil Carlson with iNews. Go ahead, Neil.
A couple of things, if I could. Does your targeting of all these employees, have you looked at a map, and does that send a message to small towns around here? Like, do 20 of them work in Crookston? Do 10 of them work in Thompson? And so on and so forth. I guess I'm not sure who wants to answer that or take a stab at it.
Neil, this is Debbie Swanson from Grand Forks Public Health Department. What I can tell you is that work is just beginning. The individuals from Grand Forks Public Health Department and the State Health Department and our partners are starting to do our contact tracing. And as part of that contact tracing, we get addresses. If those individuals live in another county, that contact tracing will occur by different staff than those that we have at Grand Forks Public Health Department. It might be public health nurses in those counties. But what we do know is when we did our targeted testing, we had a team here from the Centers for Disease Control. They just happened to be in the state, and they're very interested in looking at all kinds of data relative to where do the employees live, where did the employees work, what does the plant look like, lots of factors that will go into that. Because what we don't know, we know that there's a large number of people that have been impacted by this work site, but we don't know how much community spread has also occurred among contacts.
I guess, Mayor Brown, any comment you'd like to make? I see a lot of comments on social media or already people should stay home all over town. Or does this change anything of what you had in mind of what this should look like?
No, this reinforces our message to stay home. Avoid people, 6 foot distancing, frequently wash your hands, wash the surfaces. No, our message, Dr. Weiser and I, our message remains the same. The virus doesn't spread itself, we spread it. You stay home.
Are you looking at all what's happened down in South Dakota at the pork plant where they had a massive outbreak in one area there, kind of what they're doing and following it all, what's been happening there?
Well, we are, and that's why we thought, Dr. Weiser and I thought it was very important to get the message out early to stay home, practice these guidelines, because we need to stop this spread. And I think by being aware and being proactive, we can have a better outcome in our community. Plus, there's lessons learned from what is actually going on there. So we may expect other spikes. So by being proactive and being aware and getting the message out, we'll have a better outcome in our community.
Dr. Weiser, looking at the news release from the governor's office now, one person now hospitalized. Do you expect having any problems handling how many people actually get that sick out of this many people?
No, as I stated on the governor address that I was a part of, we're confident with our surge plan in our stage process, how we address it. We're comfortable with the modeling that we can handle a significant number of ventilated patients as well as general medical surgical patients. We hope that, like this condition as it played out in South Dakota, to your point, the plant down there, that despite very large numbers, the actual that were hospitalized was actually quite low. So we're hoping that, but we are prepared to handle whatever comes our way.